Hello friends, today we will discuss about the muscles of anterior compartment of arm. So anterior compartment of arm. First of all, the arm. It extends from the shoulder to the elbow and it has two types of movements, that is flexion and extension, pronation and supination. So here the muscles of these arm have divided into anterior group and posterior group. Today we will discuss about anterior compartment of arm, its origin, insertion, actions and nerve supply. Now next coming to the skeletal support. So the skeletal support for the arm muscles is humerus, which is the second largest bone, and this is the only bone present in the arm. And these three muscles are. So there are three muscles in the anterior compartment of the arm. These are coracobrachialis muscle, brachialis muscle, and the biceps brachii. Now its origin and insertion. Coracobrachialis. This coracobrachialis, in the name itself, we will have its origin and insertion. Coraco means the origin is from the coracoid process of scapula. You can see in this picture. So here is the origin, and its insertion is in the mid shaft of the medial side of the humerus, and so it is called as coracobrachialis. The next muscle is biceps brachii. So this biceps brachii has two heads. This one is the short head, whereas this is the long head. The short head origins at the tip of the coracoid process of the scapula tip, and it inserts at the tuberosity of radius, whereas the long head of biceps, it origins at the supraglenoid tubercle of scapula, and these two muscles join and insert as the one tendon, that is biceps tendon, in the tuberosity of radius. We will also have bicipital aponeurosis. So the importance of bicipital aponeurosis was discussed in the median cubital fossa. Next, coming to its action. Its action is simple, that is supination of forearm, and when it supines, it flexes the forearm. And the nerve supply is musculocutaneous nerve. The only nerve present in the anterior compartment of the only nerve which supplies to the anterior compartment muscles is the musculocutaneous nerve. Next, coming to brachialis muscle. This brachialis muscle, its origin at the distal half of anterior surface of humerus. If you have seen the brachialis insertion, it inserts here at the half of the middle of the shaft, and from there the brachialis muscles take the origin, and it inserts in the coronoid process and tuberosity of ulna. So brachialis is inserted in the tuberosity of ulna, whereas biceps brachii it inserts at the tuberosity of radius muscle. Radius bone. This is the radius bone where the biceps is inserted, and this is the ulnar bone where the brachii muscle is inserted here. And the action is flexion, and innervation of nerve is musculocutaneous nerve, which root value is C5, C6. Next, this is the overview of the three muscles: origin, insertion, innervation, and action. Actually, these muscles are most important in the practical section, where we have to show these muscles. We have to say their origin, insertions, nerves, and we're coming to the blood vessels. The only blood vessel present here is uh, break, uh, axillary artery and axillary vein. Those are the brachial artery, which is the same continuation of the axillary artery. So and